will now start the recording. Um, so, welcome to all our participants and welcome Dr. Miriam to the formulation of an answerable research question workshop. We started the systematic reviews uh, introduction workshop, not started, but it took place on the 16th of August. And today we are in the second part of the series for the month. I'm just going to briefly read Dr. Miriam's bio and then hand over her to proceed with the workshop. So Dr. Miriam Oyedeji Musa is a postdoctoral research fellow at the Botany and Plant Biotechnology Department at the University of Johannesburg. She has over 13 years of professional experience, and her journey in academia and research has been marked by exceptional achievements and a commitment to positively impacting society. Dr. Miriam's academic journey began with a bachelor's in plant biology from the University of Ilorin in Nigeria, where she graduated as the best graduating student in the Department of Plant Science. She further honed her expertise with a master's degree in there you see Dr. Miriam. We didn't go over this one. I'm not sure if you can hear me.
Yeah.
You're laughing. She obtained a master's degree from the University of Ibadan in Nigeria, where she conducted research on the antimicrobial activity of Nokia latifolia, showcasing her early dedication to exploring the medicinal properties of plants. Continuing her academic pursuit, Dr. Miriam obtained her PhD in botany and plant biotechnology from the prestigious University of Johannesburg in South Africa. And her doctoral research focused on the multidisciplinary study of South African Meliaceae.
Miliesi.
Meliaceae. Hi, French. Sorry, Latin is not my mother tongue. Just kidding. Delving into indigenous plant extracts, medicinal properties, and potential therapeutic applications. Apologies, participants. I practiced this like 5 times, but it still got me. Hence, Dr. Miriam's laughing at me. But that's fine. Well, thank you, Dr. Miriam, once again for honoring our invite. And I'd like to now hand over to you to start the session. Thank you. And to all our participants, we hope this will be a very fruitful session for you guys. Thank you.
Yeah, thank you, Mr. Poco. You tried. At least it's not your field, but you've actually tried. Good morning, everyone. This is just a continuation of what we started on Wednesday, systematic reviews and meta-analysis. On Wednesday, we had an introduction to systematic review. So I believe by now, those that are new to hearing systematic reviews, because on that day, many people signified they've heard about systematic review and some are engaged in writing systematic reviews and the likes, while some people are hearing for the first time. I hope we're able to pick one or two things from the Wednesday's discussion. So today we are moving on to the next on our agenda, which is how to formulate an answerable research question. Sorry, I'm having a bit of flu, so I don't know, maybe my voice is clear. Mr. Pogo, am I clear enough?
It is very clear, thank you.
Yeah, all right. So this is day 2. We'll be talking about how to formulate a research question. To formulate an answerable research question, the question must be specific. And before you formulate a question, as we discussed on Wednesday, that systematic review should be written by at least 2 members. At least 2 members. So when we talk about formulating our question, at least 2 people need to be involved in brainstorming about the question. So before question formulation, we need to establish the need for a systematic review. That is very, very important. We can't just like get up and say, no, today I'm going to write a systematic review on a particular topic. The very first thing is we need to decide, do we actually need a systematic review for this topic, or we don't, or there's no need to write a systematic review? So how do we work with that? The first thing is, okay, we need to decide, is there already an existing systematic review on the topic? Like your topic, it depends on your field and your topic of interest. You need to ask yourself, is there an existing systematic review on this topic, which you can actually check online? If the answer is no, then you proceed with one's if sufficient evidence has emerged on the topic. Like probably maybe you've got a topic now, you've searched the internet, and maybe on that topic you cannot find any paper on that topic, then what are you writing a systematic review on? Then you don't need a review on that topic. You understand? But even though it's one or two evidences you have found online, you can still proceed with your systematic review. So you can, so that is if there is no systematic review on that topic. But if there is systematic review on that topic, the next thing is you need to ask yourself, okay, now there is systematic review on this topic. Is the existing review still current or out of date since it was last updated or undertaken? For instance, if you want to write a systematic review on a particular topic and you've browsed through the topic, and you can see that the last systematic review that was written on that topic was probably in 2020 or maybe 1989 or somewhere around that time, then you feel that after that time, that systematic review was written, there have been lots of evidences on this particular topic. Then you can still think of writing a systematic review. Then another thing is you can see, is existing review sufficiently comprehensive and exhaustive of the topic in terms of databases, searched, or languages. You can have your systematic review and see that, okay, this is a systematic review that was written on this particular topic. But when you get that review and you check the review, maybe the person has actually searched, limited him or herself to maybe just 2 data or 3 databases, whereas you can see that there are other evidences which could be added to this review. Or you've seen that, no, this person has missed out some things in this review, which is very important to be added to the particular topic. So you can think of going ahead with your own systematic review. So if you feel that the existing data has been, the existing systematic review is outdated already, you ask yourself, if it is outdated, yes, no need. If it is new, then you might feel, no, there's no need for a systematic review since this is just recently written and there's no much information for you to add. But if you feel, no, this is outdated, we need to add more review, since there are other studies after the last systematic review in your particular field, then you can go ahead. Then on the other side as well, if you feel that, okay, now this topic, some things, the authors have missed out some things, they have limited themselves to some databases, whereas there are some topic related databases that you could use, things like that. So you might feel, no, we need to go ahead with a systematic review or not. Also, is existing review methodologically sound and of high quality? Have the various steps of conducting a systematic review been adhered to, or are some key steps missing? As said earlier, if you feel that looking at now, you must have also looked at your PRISMA guidelines to see the guidelines for writing a systematic review. You might take a systematic review and find, no, this person has not followed the normal steps in writing a systematic review. Some things are missing in the methodology. If some things are missing in the methodology, some evidences might be lost as well. So you might need to go ahead with a systematic review. Having established the need for a systematic review, if you have, the first thing, as I said earlier, is to establish the need for a systematic review. So once you have established the need for a systematic review, you need to formulate a clear and specific question, which should be very critical, cardinal roadmap for success, and it must influence other stages of the systematic review process, which we'll be looking at shortly. And this, as I said earlier, it needs ample deliberation within the team members. It's not just one person that will say no. You might come up with your suggestion, but the team members need to come together and see that, oh, let us discuss this. Is this question answerable? Must see that, is the question answerable? Is it relevant to the policy, like for policy makers? Is it relevant for the research, for those in research? Is it relevant for the care practitioners, for those in medicine and the likes? That is this topic relevant? Then is our question answerable? What question do we want to answer? Is it specific? Is it ethical? Is it interesting or novel? Could it be broad or narrow? Broad to encompass the diversity of studies. Like, is it broad enough? Is this topic broad enough to bring in lots of studies on this particular topic? Then narrow to provide meaningful answers when studies are aggregated. Now, if you are done, when you are done with your question, with formulating your question, okay, your topic, that, okay, this is our topic, this is the topic we want to work on. If you have deliberated and you have come to a conclusion, then the next thing is you need to think about the framework, which when you go through the PRISMA guideline, the framework for writing a systematic review is shortened as, you can have it as a PICO, you can have it as PECO, you can have it as PEO framework. So what do we mean by PICO? I call it PICO, yeah. P is your participants. In your topic, or whatever topic you feel you want to write about, after deliberating on your topic, you must have this framework in your topic. So you must be able to decide, or you must be able to see that in your topic, you must be able to identify the participants in this topic. We will come through as we go on. I will explain better. What are the participants in this topic? What is or are the intervention? An intervention might be one or two. What is or are the intervention or exposure in this topic? Then your comparison. I have put comparison in red because not all systematic review questions have comparison. In fact, not all have interventions. You will see as we go on. Then the outcome. What is the outcome of this topic? What do we expect to have from this study as our outcome? So this framework must be properly defined and identified by the team members. As you can see here, I said PEO. That means this is lacking a C. This is lacking a comparison. Not all questions have comparison. Good guide to components of well-built systematic review question is identification of relevant studies. So now to the participants. What do we mean by participants in our topic? In our chosen topic of study? Who are the study participants in terms of diseases or condition, and how defined? It depends on, okay, I've got some examples as we go on. You need to identify that, okay, in this study, who are the people, what the data we want to collect, they will be our participants. Where are we collecting the data from? Not hospitals, like, for instance, maybe you want to have a study concerning the use of the effectiveness of some drugs on a particular age group of people, maybe children under the age of 5 or adults. You want to see effect of obesity in adults, for instance. So your participants will be the adults. You want to see the effect of so drugs on, okay, for instance, there's one on mastodite drug on obesity. Mastodite is a drug which is used for obesity and in adults. So the adults, like maybe you can set your age, whatever you can say that your age is from 18 upwards, or you can say you want to look at from 20 years upwards. So those age group will be your participants. Or you might say no, you want to see the effect of something on men. Then the male in those studies will be your participants. Or you might say you want to see on female, or you want to look at a particular group of people, a particular type of disease environment, things like that. So those will be your participants. Or you want to conduct a systematic review looking at a community, an industry or setting. So those will be your participants. Then now coming to intervention or exposure. Not all studies have intervention or exposure. Intervention, like something you administer. What is the intervention or exposure of interest? Relevant mostly for intervention and etiological studies. For instance, routine prenatal iron prophylaxis. If you want to see the effects of this iron prophylaxis on female, you understand? Now, we have said routine prenatal. Prenatal, that is those people, the pregnant women, antenatal women, things like those ones will be your participants. Then now this iron prophylaxis that you want to administer to them is going to be your intervention or exposure. And for then I've given another example here. For those of us that work with medicinal plants, you want to administer your plants to the mice or the mouse or animals, you understand? So that's extract you are administering to them is going to be your intervention, because now you need to calculate, maybe you want to administer for 6 days, you want to administer for 21 days and like that. So that is going to be your intervention. Then, as I said, also comparison. Not all systematic review will have a comparison. What is the alternative being compared to the intervention? For instance, I have said now that the iron prophylaxis you want to administer to your patients, you might try to compare to a placebo to see the effects, or to see how people react to it. You understand? You want to compare your own drug to another thing. It might not be a placebo, it might even be another drug. You want to compare maybe an upcoming drug to an existing one. So that is going to be your comparison. That is, if your study requires a comparison, you must be able to identify the comparison. Optional component. Not all studies have alternatives. Should be specific. The alternatives should be specific and limited to 1 or 2 alternatives. Then selective selective iron supplements or placebo. I have said this earlier. Like you want to, the first one we talked about is a new one, but you have an existing one which you want to compare your study with. Then the outcome. What is or are the outcomes of the study? The risk, the prognostic or other factors, incidence, the prevalence. It should be specific to enhance study identification through search, and your outcome can be more than one. And it must also prevent, for instance, prevention of infant mortality, treatment of skin diseases. So you know what your outcome is. What do you like? The answer to your question, yeah, something like that should be your outcome. What do you actually want to achieve at the end of the day? what question do you want to answer with your topic. So now we can look at an example. For instance, this is a topic: to synthesize evidence on the effects of maternal supplementation with iron compared to vitamin D during pregnancy on anemia risk in children aged less than 5 years in Finland. Your participants are the maternal, like the mothers, maternal supplementation, what they take, and the children that are under the age of 5. So in any paper you are looking for, in your references, any paper you are looking for, or the reference you want to include in the study must have talked about the use of these supplements in pregnant women, and must also relate it to their effect in the age children, like children under the age of 5. If you have this risk of the effect of this supplement on adults or children above the age of 5, then it does not suit your inclusion criteria in this type of review. Then you look at your intervention. You want to give supplementation with iron, maternal supplementation with iron. It is the iron exactly you want to look at, the iron that was used as a supplement, the iron that was taken as a supplement. That is your intervention. And you want to compare this to people taking vitamin D. You want to compare vitamin D to iron. So vitamin D is going to be your comparison. And the outcome is anemia, is the risk of having anemia. That is what you want to measure. That is what you want to look at in this study. Then another example I have put up here, it's just a very simple one. Here you can see there is no intervention because we are not administering anything, and there's no comparison. But we have our participants to be the medicinal plants, and we have our outcome which we want to measure, which is the skin diseases. So I've come to the systematic review protocol. We started this last week as well. So now when you have your sorry, okay, yeah, okay, you have your question well formulated with your team. You have addressed the PICO framework. Your team is fine. You have come to a conclusion that okay, this is now we have agreed on an answerable question. So the next thing to think about is getting your protocol. A systematic review, a protocol is a systematic review roadmap. It advances before the systematic review starts. Before you start your systematic review, after getting your answerable question, your topic, that is the very first thing. Then you can now think of your protocol. This protocol helps to minimize upcoming bias in systematic review, because once you have your protocol, when you start writing your systematic review, you must adhere to the protocol you have written and concluded earlier. And it also increases the transparency of systematic review process. Others, like I said this also last week, when you have your protocol, if you have, it might be published or not. If you have your systematic review published, it helps others to know that there's an ongoing systematic review on a particular topic. So if there are thousands and millions of researchers everywhere, if anyone is also thinking of writing something like that, once he or she types it into Google, it brings it out that there's a protocol which has been registered, and such a person can actually look up to another topic. And it must address all systematic review decisions, as we'll see.
Dr. Miriam, before you proceed,
Yes.
we had a hand from the other Miriam. I don't know if she wants to go first and ask a question. Miriam?
I don't know what's happening. It's not raised on my side. Okay. I don't have
Oh,
any
okay, it's fine.
question now.
It was raised, but I guess you put your hand down, which is
Oh, okay.
okay.
I
Thank you.
apologize. Thank
No problem. We've got a question from Pat M, and the question is: would the time frame or time limit also be included here? I would presume that.
I didn't get that question.
Excuse me. Would the
Um,
time frame or time limit also be included here?
it relates to the
Dr.
previous
Miriam, I
parameters.
think,
Yeah.
yes, I was about to say that. That's why I moved back a bit. Dr. Miriam, it relates back to the previous. Oh, Pat, you can also ask here, it's fine.
Thank you. It was asked now. So, when you consider, you were talking about age group or uh, just around when you discussed intervention after that, you talked about other parameters. So, I was wondering if you would include when you essentially formulating at that time the cutoff point to look at the outcomes, if you know what I'm saying.
Yeah, when you're formulating your question, one thing must be at the back of your mind, that what question do you want to answer?
Hmm.
That should form part of your outcome. Like at the end of this review, what question is our review going to answer?
So if
I
you
don't know, maybe I
formulate the
answered your question.
question at that time, you would have to include, say there's an intervention, for example, you would have to look at the effect of the intervention up to a certain point in time. So you'd have to include a cutoff time.
Yes, you have to include a cutoff time.
Yes.
Because it's, at the end of the day, you must know that, okay, in searching for these articles, this is what we actually want to achieve at the end of this. So you might have lots of studies. It depends on the field that looked into a lot and very wide range, but at least you and your team must come to an agreement to say, no, this is what we want to look at, this is what we want to stop, this is the cutoff point, this is our benchmark, this is where we are stopping. So all this must be included in your topic, so that by the time you start getting your references and you start screening down your references, you know which ones to include and which ones not to include.
Thank you. So that would be the appropriate point, a reference point to include that parameter. Thank
Yes.
you. Thanks.
Yeah. Thank you so
We have
much.
an Lulama, I've noted your hand. I just want Lydia Palcher's question to be answered first. If we synthesize, will that be considered inductive or deductive research?
I don't understand what the person means by synthesize and deductive.
Lydia, do you want to perhaps just open your mic and ask?
Yeah.
Good morning. Yes. So
Good morning.
what I'm sort of looking to do is to use my systematic literature review for inductive reasoning, so to create new knowledge. So I'm just trying to understand the difference between the two. Because as far as I understand, if you create themes, that will be considered inductive reasoning or research, and deductive is, I'm expecting it, if it's desynthesized, or that fall rather under deductive reasoning, because you are just putting together what is already known. So I'm not sure. I need clarity on that, please.
Yes, like you said, for systematic review, you are trying to put together what has been known. Like it's not that it's something new, but you are bringing together what has been done. Then at the end of the day, you compare the results. You can compare the results of what has been done. Then you come up with your own conclusion with regards. But if you are writing a review on a particular on a new, I don't know, maybe I got your question, on a very new, because you said you are trying to bring in new concept or something like that, on a very new concept, on a new ground, or maybe a new methodology to something. I don't think you can conduct a systematic review on that, because if there is no existing knowledge with regards to that, then what are we going to compare? Then it would be very, very nice for that study to be the first study in bringing up a new methodology with regards maybe a particular topic. Because if you want to put up a systematic review and you don't have maybe at least one or two paper that has recorded anything study on that particular topic, what do we compare?
Yes, so I've read from other sources that you can actually use a SLR for inductive reasoning. I was actually more focused on the technicality
There's a
to it.
background noise. There's a background noise.
Yes, from your side also. So
Okay,
I
from my
was just
side.
more wondering about the technicality, but no worries. Thank you. I'll follow up.
All right.
Okay, can I comment on that? It will also
Okay.
depend on the years you're considering. As far as my knowledge can deal with this, probably if you're saying deductive, what years are you setting up for your deductive to be? If it's recent, what years are you also setting up for your recent years? If you're saying maybe from 2020 up till now, in your own field of study, can that be applied as recent? So I think if you are considering the years, you can be able to separate your deductive study from the inductive. I don't know if that's a work. Thank you.
Yeah, thank you, Dr. Miriam. Like I said here on this slide, like if you look at your study and you feel that what has been written is you have maybe the existing review still, is it still current or something? What you have on that topic, is it current? If it is not current, like what she said now with dates, maybe you are thinking that, okay, from so year to so year, now this is what they've been doing, but you want to come up with another thing from this year, or maybe from 2020, you've noticed that there's changes, or they need to they've shift the research has shifted from one angle to the other, or things, something like that. You can try to go on with your systematic review.
Thank you. Lulama, you can go next. Lulama? Lulama, can you hear us? The floor is yours. You can ask the question. Okay, I'm not sure what's going on with Lulama's mic, but I will come back to her when her mic is working. Dr. Miriam, I think then you can proceed in the interim. Thank you to all the questions. There was another one from Wanda. So SR will first be deductive reasoning. I'm not sure if Dr. Miriam, the other Dr. Miriam, also answered this question though. Wanda, maybe perhaps you can just indicate whether your question was answered or not, and then we proceed on out.
Sorry, yes, thank you. Good morning, everybody. No, it wasn't. It wasn't a question to answer. It was just a deductive or a comment to make that because we are not going in with a clean slate like inductive reasoning, there is some documents and there is some research done before, so it will more lean towards deductive reasoning than inductive reasoning, and then from there you can use others. You can move to new knowledge. So in terms of this systematic review, the way that I see it, it is the deductive reasoning first. Sorry, it's just a comment.
Yeah,
Okay, no
thank you.
problem.
Thank you
Thank
for
you,
that. Thank you
Wanda.
for that.
I
Yeah,
saw
thank you.
Archibald. Archibald? Archibald. Archibald. Studio had a question. Oh, their hand was raised. Oh, okay. There's Lulama's question.
Oh,
I
okay.
can hear you, but you can. Yes, we couldn't. Sorry. Can we use the Prisma framework outside of the science field within business and finance? Do we have examples of this?
Yes, as we go on now, I will show some examples. Then you can also go to the website, the Prisma website, and see how the protocol and read up on it. Then you can decide if it suits your field of study. But I'm still going to show some examples as we move ahead. Yeah.
All right. Okay. Back to you, Dr. Miriam. Thank you.
All right. Thank you so much. So, in looking at the systematic review protocol, as said earlier, it should involve your team, as I've already said, 2 to more people. And this protocol should have the same context as what you propose for your systematic review. The context should include your abstract, your background, the aims and objectives, your inclusion and exclusion criteria, the preliminary search strategies, then the study selection, the data extraction process, the quality assessment synthesis, and your dissemination plans. So let me say this protocol is like a proposal. Yes, let me say something like that. Like when you are writing a proposal in your research field, that okay, this is what you want to do, this is what you want to do, this is what, yes. So your protocol is just like something like that that will guide your steps by the time you start writing your systematic review. So I have put this up, like to adhere to this, you can search your, I think these slides maybe might be shared with you later. You can have the Prisma website, you can check. So, and your protocol, if you feel you can publish it, if you don't feel, maybe you might not publish it, but you should try as much as possible to get it registered if possible. And these are some websites that register. You can use Prospero, you can use Research Registry, and there are some other journals that also publish protocols. It depends on your field of study, which you can also check within your field. What do we mean by Prisma? This is the preferred reporting items for systematic reviews and meta-analysis. I've said that here that Prisma is an evidence-based minimum for reporting in systematic reviews and meta-analysis. Prisma primarily focuses on the reporting of reviews evaluating the effects of interventions, but can also be used as a basis for reporting systematic review with objectives other than evaluating interventions. Who should use Prisma? Authors. Prisma aims to help authors improve the reporting of systematic reviews and meta-analysis. The journal peer reviewers and editors. Prisma may also be useful for critically appraising published systematic reviews, although it is not a quality assessment instrument to gauge the quality of a systematic review. But a reviewer, the journal reviewers and editors can use this Prisma to see if a submitted protocol or a submitted systematic review has actually followed the proper guidelines. Benefits. What are the benefits of using Prisma? It demonstrates the quality of the review. It allows readers to assess the strengths and the weakness of your review, and it permits replicable of review methods. I said this on Wednesday, a systematic review must be reproducible. And how do you know if it is reproducible? Your methods must be well stated. It must be well stated and understandable by the person reading it, by the reviewer or by the reader of your article. He or she should be able to go through your steps and look at the replicability of that study, which is very, very different from writing just a normal review, which could involve lots of bias by the author. The author can choose depending on his or her discretion. But when it comes to systematic review, since it's a teamwork, the team must come together, have a standard protocol and methodology to follow. The structure and the format the review using Prisma headings. Once you use your Prisma headings, starting from defining your framework and the steps it requires, consistency, and it must be reproducible. These are links to examples of protocols, examples of published protocols. It's online. You can get this. When you get there, you see the way the protocol is written. Then you can also see from your field. You can search for protocols in your field that has been published. This will be a guideline to you when you want to start writing your systematic review, and you can decide this is the way they write. For each field, there might be different ways they write in each field. There is definitely the way they write in different fields are definitely different. So you can try and check for existing protocols as a guide to your own protocol. Identifying studies. If you want to identify your study, the goal must be the first thing. You identify all relevant studies on the topic. On your specific topic, you must identify, as on Wednesday when we're defining systematic review, that was why I said, no, I will not go with the definition by Wikipedia, which says it's collecting studies of high quality on a particular topic. No, you must assess all relevant studies on a particular topic at the first stage. Before you start screening, you must collect all relevant studies on that topic. It requires exhaustive search strategies. You must not just, there are some databases that are specific to subjects, that are subject specific. So you must identify those ones and say, okay, fine, in our study, these particular databases are specific to our field. Before then you can also go to the gray searches to search and get more references. You cannot just with your discretion and say, no, I just want to limit myself to Google and Web of Science. No, you must have tried all searches, list your searches, and say, okay, fine, since it's going to be a group, your team members come together, these are subject specific, these are the gray searches. We have to search all these databases to see what we can get. All potential sources must be searched, and it requires the teamwork, as I've said, subject experts in your field. You can include your librarians, because librarians are very, very much important, and they are very much knowledgeable when it comes to searches. Yes, and other people that are authorities in your field. Maybe within your field, your team must know about the subject. Search sources, I've listed just a few here. International electronic databases, you have the Medline, you have the Embase, you have AMAD, you have CAB, you have Cycle, you have Signal, Web of Science, Scopus, Cochrane Library, you have the Google Scholar, you have the WHO World Health Library. You have lots and lots of databases, which I know most of us are very familiar with. Then you can also check these unpublished ongoing works. You can also check and see trials, especially those in the medical field. Then also still on search, how to search your databases. You can contact your authors, experts, the gray literature, reference list of included papers. When your papers that you're including, you see some of these databases are what those people have included. So you can check their reference list to see where you can also search for more references for your study. Then the search strategies. you must dissect the systematic review topic into concepts. Now you want to search, you want to start your search. What are the strategies to use? Do you just take your topic and just put it on the internet like that? Oh, this is a topic I want, then you start searching. No, when it comes to systematic review, you must dissect your systematic review topic. What I mean by dissect, you must, as we have talked about our framework earlier, your PICO framework, you must be able to dissect your topic to say, okay, these are our participants, these are our interventions, our comparison, and our outcome. Then from this, you must develop your keywords. Your keywords, by developing your keywords, you must use various synonyms. You must search for synonyms so that anyway, maybe for instance, I'm looking at typhoid fever. I know some people call typhoid fever February fever. Some people call typhoid fever Salmonella typhi infection. You understand? So like there are some papers that might be treating typhoid fever, but in that paper, they did not refer to it as typhoid fever. In that paper, maybe the author has referred to it as Salmonella infection disease, or the author has actually referred to it as febrile illness. So if I don't search for synonyms to my concept, to my keywords, then I might be missing some important papers. So the first thing is, after dissecting your topic, for each concept, for each concept, you come out with your concept. From each concept, you must look for synonyms, so that when you are searching, you search for the keywords and including the synonyms, so that you will be able to get all the data with regards to your topic, and to avoid bias and missing out important papers on the said topic. Produce search terms, synonyms, abbreviations, spelling variants, then database specific variations. I've said it, you must check your, make sure that you've included databases that are specific to your field, as well as databases, the grade data search. And you can also use the mesh terms from your databases, which brings together variations in your search. It should be highly sensitive and should be exhaustive. Still on the search strategy, interactive. It must be interactive. You must pilot, you discuss it, you pilot, you discuss it before you finalize. That is the teamwork. Your team members must come together. Okay, now this our search. We want to search our topic now, and we have come out with our concepts. The concept is going to come out from your PICO framework. Each participant intervention, your comparison, and your outcome will form your concept. But each of these will have your keywords. You must have your keywords for each of these, which must be spelled out, which must have included your synonyms, it must have included your mesh terms. If you want to use mesh terms, you must include your mesh terms. It must be well spelled out before you start your search. You have some search filters here, which I have included here. And you can also check with care with limits, your time, your language. Then you must be very, very sensitive in using your Boolean operators, your and, your or, your truncation, or your parentheses in this search, so that you can broaden your search and make sure that you are not missing out any important information. Some important thing we need to know when using the Boolean operators to for our search, we must use of hand. We give results like this, which narrows our search, and use with separate topics, especially when you want to do separate topics. But when you use an and, it limits, it narrows our search. For instance, we can see child and head injury. So like this is different. This is not like, it's not a synonym. We are trying to look at head injury and a child. So, okay, I will still talk about this truncation. What it means. This is trying to say that when you say child, you want anything, any paper that has, you want all references that have written anything from child, children, anything that has the stem word as a child in relation to head injury. You want to retrieve everything. So that is why this truncation is there. Rather than you writing child, then at the end of the day, there are some references that have not even written it as child. They have written it as children. If you don't put this truncation, that means it's going to just return to you only, it's going to return only the references or only the studies that have written just child and head injury, not anything that has included children. So in that, you'll be missing out a lot of information. So that is very important to use this truncation when you have word then for your search. And the use of or is, it broadens your search with use with synonyms. When you are using your synonyms, you can use an or. So an or will give you anything in A, anything in B, or anything that has incorporated both A and B. For instance, you want to your search includes children. Fine, some papers must have recorded their search as children or child. Having it as child with this truncation, we retrieve anything with the same word of a child. It might be child, it might be children. Then or pediatric. Some papers might not refer to it as child. It might be pediatric or things like that. So now with this pediatric or pediatrician or things like that, it's going to retrieve everything which is also related to a child. These are synonyms. If you check for synonyms, these are what you get. Or infants. Some might be reported as infant. So in this way, you are using your or to make sure it broadens your outcome, your search outcome, and to make sure that you are not losing important information from your search. This can be used for each concept. Then by the time you start adding your concepts together, then you can now, since your concept now is going to be different headings, then you can use your hand. But within a concept, it's very advisable to use the whole operator so that you can have all the data in that concept complete. Also, the use of parentheses allows you to combine the concept. I said that earlier on now. Like this is a concept now. You are using child or adolescent. So now you have your truncation. So you can search for a particular concept using your or. But now you want to combine, because after searching for each concept, you now have to combine the whole concept to get your final references. Because by the time you start searching each concept, you get lots and lots of references. You have thousands, millions. There are some that will run into millions of references. But by the time you find all your concepts and you narrow it down with your hand and to combine all your concepts to one, to make just your one topic, at the end of the day, you might have less than 20 included references. So that is the most important thing, and that is the importance of your end when it comes to searching. Then also the use of quotation marks keeps terms together and in order. Emergency medicine versus emergency medicine. This is the quotation mark. By the time if you want to search and you write emergency medicine like this, believe you me, your search is going to give you it's going to search emergency separately, it's going to search medicine separately. So at the end of the day, you have thousands and millions of references compared to you searching emergency reference as a word. So this quotation mark is giving the information that no, I want you to search emergency medicine as a word. So whatever you have with this parenthesis, we give you only the references or the studies that have reported emergency medicine, compared to when you have emergency medicine. Yeah, then you are going to retrieve anything out there that includes emergency, anything out there that includes medicine. Then in fact, you'll be frustrated with the data you will get. So this strong quotation marks is also very, very important for the search. Also using the truncation. Okay, I think I said this truncation. I said it earlier. Also using this truncation, you have to determine your step word. So now you want to search, intubation. There are some papers that might have written as intubation, intubating, intubate, and it's still on your topic. It's still important. So you don't want to start including all this in your search. So you just include intubate as a stem word with your truncation. Then everything that has this as stem word will be included in your retrieved reference. So now I've come up with a topic. For instance, we have prenatal maternal psychosocial stress and offspring asthma and allergic disease, systematic review and meta-analysis. As we said earlier, you break them down. You break your topic down. Now you can see our topic. We have broken it down into our PICO, using our PICO framework into, so this will form our concept, our different concepts. So now concept one. My concept one here is maternal, prenatal maternal. So we have tried to come up with the synonyms. What can we get? Pregnancy or pregnant, or antenatal, or prenatal, or prenatal care. So with these synonyms, you can feel that, okay, now if I include all these to my concept, if I search all these, then I'll be rest assured that, yes, I've got all these prenatal, maternal covered. Any reference that has this will definitely cover this search. Then our concept two, which is the psychosocial stress. Stress, psychological, or anxiety, or distress, or negative life events. You can see the marks, the quotation marks, so that I don't want you to search negative separately, life separately, event separately. No, I want negative life events, or negative life events, or depression, or bereave, or adverse life events, or widow. All these synonyms, you can easily get them online, and you can easily get them from your database. For those people that use PubMed, when you go to PubMed, you can get this. When you go to your advanced search, you can get all these synonyms. When you type it in, you type your topic in or your concept in, you get a lot of synonyms which you can search. For offspring, offspring can be infants, it can be infancy, it can be child or children or adolescents or offspring written together like this. So you can check, you can include as much as possible, but not too wide or too broad, so that your search will not be overwhelming. Then concept 4 is the asthma and allergic disease. Asthma or weaks or respiratory hypersensitivity or hypersensitive or apto allergy, dermatitis, atopic dermatitis. All these are things you can easily get from your databases. Your synonyms are not things you can just stress yourself and be thinking about. When you go to your database, you get synonyms for your search word. So, having collected all the relevant terms defining each component of the topic, you have to perform the search in different databases. This has been said earlier. You make sure you perform your search in different databases, making sure that you have included the relevant databases to your field. Remember, we are writing for the public and the audience. So someone might just pick up a paper, maybe a professor in your field, and feel like, no, from your methodology, why didn't this person include the Cochrane Library, for instance? And this is a database which is specific to the medical field, so it might be questionable. Then you must make relevant combinations. When we talk about combinations, that is when you are talking about the use of your Boolean operators, the use of your and, the use of your or. How do we combine these things together to get things that are reasonable and to get your reasonable searches? So after getting your references, now you are set. You have your references from different databases. You have collected from different databases, and you and your team members are happy about it. That's fine. You have collected all which is required, and you feel that's okay. You have exhausted all the databases. For example, I would just say something about Google Scholar. Google Scholar is very wide. You get thousands and thousands of references, but what we mostly do, or what people mostly do, is you check the first few pages based on relevance. Maybe you might get up to 20, you might get up to page 30. It depends on your field. You might, maybe even in your field, there are some fields that maybe when you search using the Google Scholar, you might not have more than maybe 10 pages. Whereas in some field, when you search, you might have up to thousands of pages on Google Scholar. But by the time you start searching, you go through these one after the other. Maybe by the time you get to page 20 or page 30, you notice that no, other references are not relevant, or some of these references are just repetition of what you have gotten. So this, you can stop here, and this should be included in your methodology. That's okay, your Google Scholar, you decided to stop at page 30 based on relevance of the study. So you can stop. That should also be decided by the team members. You know why you are stopping at a particular point. But when it comes to Cochrane, Web of Science, those ones, I don't think okay, it depends on the field anyway, but for the ones I have worked with so far, they don't have too many references pertaining to the topics we have been working on. So we could actually include all these references. Now the work will start. You have all your references from each from different databases. How do you combine them? How do we use them? What do I use? How do I combine all these references? Do I need to start reading all these references? What do I do with them? No. What you do is, now you have all your references. You might have lots and thousands of references, which is expected. Then you know you have covered a lot. Then you can now export your references to your reference manager. Many people there are lots and lots of reference manager people use in screening and removing the duplicates of their references. But I use Ryan. People use Mendeley, EndNote, and the likes, but I like to use Ryan. You export your references, and Ryan takes different types of file formats. It could be in Excel, it could be in EndNote. Yeah, it takes different type of file formats. You can send your references, you export your references to Ryan. You create a worksheet in Ryan, and just with a click, you can detect your duplicates. And this also should be done by the team. You can detect your duplicates immediately, then you remove the duplicates, and you have the remaining sitting amount of references which you need to further your research on. You might, at the beginning, you might have maybe like thousands, but by the time you remove duplicates, remember you have searched from different databases, so it is expected for you to have lots and lots of duplicates. You have searched PubMed, of course. Whatever PubMed gives you, you can definitely find it in Google Scholar. You can also find it in Cochrane and Web of Science. So it is expected to have lots of duplicates depending on the amount of databases you have searched. So with a click, you remove the duplicates and you are sitting with just a representative of each study. All right, then now we come to your data screening, literature screening. Let me call it literature screening. So after the exhaustive search, you have exhaustively searched your databases. Now you have retrieved numbers of papers, can be large, potentially relevant papers, as well as irrelevant papers. Definitely irrelevant papers will be collected. Only a small proportion will be eligible. All records need to be carefully screened. Import papers to reference manager. I think I just talked about this now. Once you have imported your papers to the reference manager, with a click, you can determine, you can detect your duplicates, you remove the duplicates, and you have individual representative of each study. Then from here, you can continue with your literature screening. The objectives of the literature screening is to ensure all relevant studies are included and irrelevant studies are excluded. It determines the several stages of key decisions. It must be done by more than one person independently and an arbitrator. It must be explicit, objective, documented, and reproducible. This is what I have been saying, that once you remove your duplicates, the next thing is now you need to screen your literature. You need to screen your literature. It's not everything. Of course, remember, you must have included both relevant and irrelevant papers. So we have to screen now. This screening should be done independently. Maybe A or B, it depends on your team. You must have shared out this responsibility within the team that, okay, Mr. A and B, you are going to screen using the abstract and title. That should be the first stage of screening, using the abstract and title. So using the abstract, you go through the abstract independently, you screen. If I want to include, I click on include. If I want to exclude, I click on exclude. Then I can also include my reason. Why am I excluding this paper? After screening with my title and abstract, then the two of us will come together, or the whole team members will come together to look at our discrepancies. Definitely, there will be some papers which I have included and the other person has excluded. There will be some papers which the other person have included, while some which he or she has excluded. Then we must come together and look at this and say, no, okay, fine. Why do you think we should exclude this? Why do you think we should include this? Although at this stage of excluding using the title and the abstract, lots of papers are excluded, fine, because immediately you look at the title and the abstract, you say, no, this does not follow our topic, or this is not the main aim of our research. Then you can also exclude at that stage. Then the two of you come together and the team, then you can decide before you carry on that, okay, we have to decide. Then the two of us have the same number of included papers and the same number of excluded papers. I think someone has a question.
Yes, Wanda, you can go ahead.
Thank you. I just want to know, when you start with the reviewing of the articles and the literature, do you need to have record of every single article that you reviewed or abstract that you reviewed and the reason why it was excluded? Must in a systematic review, must you keep record of everything like that? Because normally you would quickly look at the article or the abstract and you would say, this is not for this study, but this is. But my question is, for evidence that you looked at everything, would you need to have a record of every single article that you received and that you excluded and the reasons why, and then at the same time included and the reasons why? Thank you. I just want to find out that.
Thank you so much for that. It's a very important step you need to include. I will still come to that because there's going to be a flow chart which everything must be included. You must include everything you have gotten and the reason why you have excluded them. That is why I said, I was talking to Mr. Boko. This workshop is actually meant to be an hands-on so that we can see how it works. I use Ryan. So in Ryan, you can actually get all this information stored. Once you have exported your data to Ryan, and you have excluded some papers you have excluded and those that you have included, you have all this data stored in Ryan. So by the time you start writing, you can go there and see all what you have done and put your steps in your methodology. It is very, very important to take note of the papers you have excluded and the reason for exclusion at each stage. Do I answer that?
Thank you. Yes, thank you. Because I think it's quite a lot and it's an intensive process. So there's lots of steps and work when you do a systematic review so it seems.
Yes, 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 but I don't know how it works for other reference manager. But if you have tried Ryan or other people that have tried Ryan, this is it's very easy to work with. So that in fact, maybe by the time you even start writing, you can go back to Ryan and see all what you have done from the beginning. You understand? So it will be very easy for you to say, okay, when I started with 50 papers. When we excluded the first stage, we excluded 25. We had 23 included. Okay, after inclusion using the abstract and the title, we went to look at the papers. Now to read at the papers, we excluded more, and the reasons in Ryan, you have the places there where you can actually input the reasons why as you walk along. Okay, maybe participant A has excluded a paper. Immediately you can input the reason why you have excluded that paper. You understand? You can input it. So these are things that are database that you can keep. You don't need to stress yourself. By the time you want to start writing, you just go back, then you see all the information and you can extract this information. But it's very, very important at every stage to put in the reasons. Then you put those reasons there, they sit there. Then when you start writing, you can retrieve all those information at just a click. Mr. Pokot, can we continue?
Yes,
Mr.
please.
Pogo?
Yes,
All
we
right.
can. Thank you.
All right. So, okay, still on the literature screening, all decisions must be based on criteria specified in the protocol. As we said earlier, your protocol should be like a working guide. All the criteria you have specified there, so your decision must follow this protocol. You must have included your inclusion and exclusion criteria and things like that. Dr. Tepo will talk about the inclusion and exclusion criteria next week. Then any modification must be justified and documented. Anything maybe during during your search or during the study, you have some modifications to what you have in your protocol. This must be included in your documents. Then review timeline as a result of large amount of records. You must limit your setting, like someone asked earlier, your topic must not just be just wide without any barrier, anything. Then at the end of the day, you might struggle. Yeah, then I've said a lot about this earlier. Which is expected. You have a lot of duplicates. But Ryan is a It's just the software online. You can't download it, but just register with it online. It's free to use. It's friendly. You can play with it. Then more than one record in a specific database, you need to have, of course, you have more than one record for each data for different databases. So that is why you need to remove your duplicates, because you have multiple databases. You remove all duplicates and have just one representative for a particular study. Then the second stage is to screen by titles and abstracts. I think I've also said a lot about this. The duplicate titles and abstracts, you assess against inclusion criteria. As said earlier, you must have decided with your team what are the included, what are your criteria for including your papers, and what are the criteria for exclusion. So whenever you are going through the stages, you must have that in mind, that okay, these are what we want to include, these are what we want to exclude. We don't want studies that's talking about this, we only want study that is talking about this. Okay, for instance, let me give an example of we want to look at for instance, we want to look at medicinal plants. I'm talking more of plants because I'm in the plants field. You want to look at plants that are used in treating. You want to look at plants that are used. There's no pharmacological evidence of plants that are used in treating a particular disease. But by the time you start searching, you find out that okay, you have papers on compounds that have been extracted from some plants against such diseases. But you know, in our inclusion criteria, we just want to look at the plants, the recorded plants. We don't want to look at the compounds. So when you find those papers which are reporting compounds, then you know, no, we are not looking at compounds. Then another thing, I might decide that no, I don't want to look at animal study. We want to look at studies in vivo. We want to look at in vitro studies. So by the time you start checking your references and you are getting in vivo studies, then you know this is not part of your inclusion criteria, which must have been discussed earlier before you proceed to your study. The studies not meeting set criteria should be rejected. Studies that are not relevant to the review, you reject with reason. Your database, as I told you, I'm very much conversant with Ryan. It gives you an option there to include your reasons for rejection. Failing in one or more criteria, reject with reasons. And there are some, as we talked about age, gender, and setting, which I said earlier, there are some papers that might not be relevant to the age group you are working on. So you might also exclude with that, saying, okay, this is not the age group, or we are dealing with the male, but this paper is on the female, the setting, the community, and things like that. Eligible studies or those difficult to reach decisions. There are some studies that you might not be able to reach a conclusive decision upon, which should also be rejected. And you must also know, okay, but that is when you obtain the full text of more detailed assessments. After screening through your abstracts and titles, then the next thing is you must now get the PDFs of these included papers. Then you have to share within the team. You have to read the text to see to go through the text to see if those papers you have concluded after screening with the title and the abstract, if you actually need to include all these papers or you still need to reject. You will definitely see more papers will also still be rejected by the time you start looking at the full text. Some papers will still not meet your included criteria, and there are some papers that you might not be able to get the PDFs. So the advice is you can try to contact the authors. If you get feedback from authors, fine. If you don't get the feedback from authors, those papers will definitely be excluded with reasons as well. So now, stage 3, you resolve disagreements. After searching, after screening, remember we said it must be screened independently. Then you come together to resolve your disagreement. Also looking at Ryan, in Ryan you can check the disagreement level, the agreement level, the number of included papers, excluded papers, and discrepancies. You will see everything there. It's a record that can definitely, this is a database that you can go back to by the time you start writing, and you make sure that you don't miss any of the steps, because those steps will be there. Since you have registered, you have access to it free online. Then you can download and you can look at it, then put up your write-up. Disagreement may be simple, oversight, or a matter of interpretation. These are some ways we might disagree. You understand? Maybe by the time you come together, then since it's a teamwork, then you explain, oh, then the other person gets that, no, this is an oversight, or maybe I have interpreted this in another way. Then you can now agree. It should be discussed for consensus between reviewers. If no consensus, then an arbitrator is required. But mostly, since the team is a team of people that really understand the field, they normally get to solve this disagreement and move ahead. So records from databases search. So this is how the process looks like. For instance, now you have your search databases included in your reference manager. Reviewer 1 independently screens. Maybe now you have 1,943 titles and abstracts at the end from 1 million. You can have papers as much as papers. So by the time you screen, you removed your duplicates, you might have maybe just 1,000 plus. The second reviewer also screens. Then the two reviewers come together and look at the discrepancies. Maybe at the end of the day, I have included 1,000. The other reviewer has included 1,100 or 1,050. Then we can say, oh no, why this and this? Then we look at it together. Then they come together. Then now you move after solving these discrepancies at this stage. The next stage is to look at most papers are excluded at this stage. Action, then you record the number excluded. Can you see what we're saying about that? You need to record at each stage the number of papers you have excluded or included. And this is also very easy with Ryan. It keeps your data for you. It keeps it for you. Once you exclude and you include, you don't need to stress yourself. It's there. The number of included is there. The number of excluded is there. You can get it at a click. Then now potentially eligible papers are included and taken forward for full text screening. Now you need to go through your text. From this text screening again, it should be done independently. The reviewers do that independently. Then the pair meets to discuss stage 2 screening and they resolve their discrepancies. Also here, the number excluded must be taken note of and the number included. More papers are excluded. As I said earlier, when it comes to full screening, more papers are excluded. Record number excluded and reason for exclusion of each paper. In here you have, in Ryan, you have a place to write your reasons so that by the time you start writing your flow chart, to be easy for you to put this information. Then definitely eligible papers are included and will be used for the review action. Record number of final paper included. After going through the full text, then you have your final included papers. Reporting literature screening, I will recommend the Prisma flowcharts, which I'll be showing you soon. Then you can go to Prisma statements. You can go online with these links and get some more information. Now looking at the Prisma flowcharts. You have your Prisma flowchart like this. You can get the flowchart online. So this must be included in your systematic review when you are reporting your systematic review. First, records identified through databases. For instance, you have 624 papers recorded from your databases. That is, by the time you put all your databases from each search together in a folder and you send to your reference manager. I've been talking about Ryan because I'm more conversant with Ryan, so sorry for that. So if you put it together, it gives you a total of the number of searches you have, of the number of references you have, a total. Then now, after putting your total, you must know from each. Also in Ryan, you will see it there. There's also a tab which tells you that, okay, from PubMed, you have these, from SciFinder, you have these, from Web of Science, you have these, from this database, you have these. It's there. So you just need to copy and paste in your flowchart, or just look at it and input in your flowchart. Then you have your additional records identified through dissertation or database. That is, if you are using other sources aside from these databases. If you want to search maybe dissertation or something, you can include it if you are using those ones. Then after that, records after duplicates removed. After your duplicates must have been removed, then you come back. For instance, this study added 624 and 3 from databases. But now, after removing the duplicates, we have 469 references. Also, the screening continues. Records screened, 50. Records excluded, 419. That is now, you can see now, after removing the duplicates, you have 469. But now you need to screen. After screening, from using the abstract and the title, which is very fast, which works very fast because it's just the title and the abstract you're looking at, you have only 50 references which suit your inclusion criteria, and you have excluded 419. That is how it comes down, because at first you might be so overwhelmed with a lot of data you get, but at the end of the day, you have to screen this data and work with a very minimal amount of data. Now you have gone to screen your full text articles. From these 50, only 22 are eligible. Full text articles excluded with reasons. Now you have four. No necessary data. 2, overlapping data with other studies. 2, can you see how we are now starting to break it down with reasons that, okay, these are the reasons why we have excluded. Then now at the end of the day, the studies you have included is just 18. That means you have only 18 references or 18 papers to reference and to look at and to extract your data. Because from now, where you have concluded that, okay, we have our 18 included papers, which must also be decided and agreed upon by the member of the team, then you go to your data extraction stage. Yeah, I think for today, I would like to stop here for today and expect Dr. Tepo Muloi next week, Thursday, to continue with the inclusion and exclusion criteria. Yeah. Thank you, everyone, for listening. I would like to welcome any question. Mr. Boko?
Yes, just busy unmuting my mic. So Pat says, are there guidelines for a desired? I'm not sure what happened to the rest of the question. Because they said, thank you, doctor. It would be nice to also have a practical embedded video search with these protocols within the recorded session.
Yeah, I've included some links in the slides.
Okay,
which could be useful. Yeah.
To further. Then, Pat, would you mind asking your question then? And then, okay, Wanda, you go first, and then Pat after.
Sorry, I just want to ask I'm not sure how you spell it or how you pronounce it, the Ryan what database or
Okay, let me just put in the
if
chat.
you can please send us the link as well, because that would help us, if we have to
All
look at
right.
something like that. Thank you very much. Appreciate.
All right. All right. So let me just try and get this out there. Okay, Mr. Poco, you can continue while I get the link.
No problem. Pat, would you mind asking your question? Thank you.
Thank you. Relating to the last slide, where you basically drilled down according to a flow chart to the relevant number. So I think the last one ended on N is 18. Is there a desired or a preferred number, or is there a range that you would get to make more meaningful conclusions according to your systemic review?
All right. And no, it depends on, okay, sorry, I was trying to put I'm not familiar with this collaborator board to put the link on the chat, but I can't even see where to put it. Okay, I'm coming, please. All right. Mr. Poco, can you please help me go through my slide? I don't know, I can't navigate up from this side.
No problem. Okay, where would you like me to go?
The chart, the flow chart.
Okay. 1 second, everyone.
Yes.
Okay,
Yes.
the Prisma flowchart. Okay.
The Prisma flow chart. No, I'm saying that after the full text was assessed, because when you get to this stage of assessing the full text, you will definitely still see some articles that you need to exclude that does not fit into your inclusion criteria. So from this study, 22 articles were included. But now, after going through the full text, you notice that no, some of these articles needs to be excluded because of some reasons. So this study came down with just 18 articles. There's a particular systematic review into now. We have only included 2 papers. So it depends on your study, and it depends on your inclusion, your set inclusion and exclusion criteria. So it doesn't have a limit. It doesn't have a limit. It depends on your study and your defined inclusion and exclusion criteria. That will form your decision with your team on the total amount of papers you are going to include in your study. I don't know if
Thank
that
you.
answered your question.
Yes,
Yeah.
it does. So would there be a minimum that is required to make the study meaningful? In other words,
No.
you have to go back to the drawing board and
Mm.
do a whole lot more work if your numbers are too low.
Like I said that there's a particular study, we have included just 2 papers. It depends on the amount of papers that are available for that particular study. You can't just say, okay, because I want to have too many papers, then you include papers that are not relevant. So that is why we are saying that Dr. Seppo should speak more about this next week, about the inclusion and exclusion criteria. It's also a very important step which must be concluded before the start of the systematic review. The team must agree on what are our inclusion criteria and exclusion criteria, so that by the time you start this process, each person knows that, okay, when we are including our papers, these are what we want to see. These are this is our set, our maybe the goal, or the length you want to go with your systematic review. These are what we are looking for. Then it will form your decision in making your included papers and excluded papers. But as far as I know, there is no limit, and there is no limit to the number of paper. And there's nothing like, no, this is too small, we cannot write. No, it depends on what you have actually spelled out in your protocol. So when you continue your writing, it informs your decision.
Thank you so much. That means, for me, the criteria initially, as you say, exclusion criteria are very, very important. Thank you very much.
Very, very important. Thank you so much.
Thank you.
And you can see for reasons, when you have included the reason that, we have excluded these papers because of this, then the readers know that, okay, this is not part of what you are actually looking at. That is why you have excluded some of the studies. Yeah, over to you, Mr. Puko.
All right. Do you have any further questions? The floor is yours. You can raise your hand and ask.
Then I put the link for Ryan in the chat box. I don't know if you can see it. Can you see it, Mr. Puko?
Let me just check.
It's
okay. I got it.
All right. Yeah. All right. So you can just check it, read more about Prisma, then look at this Ryan, play with it. Yeah, it's very friendly from my experience. Yeah, it's very friendly from my experience.
Okay. All right. It seems like we have no further questions. So to all our participants, okay, thanks, very helpful. To all our participants, thank you once again for staying throughout the whole session. We've put the evaluation link in the chat. Please do take 2 minutes of your time to complete it for our reporting purposes. To Dr. Miriam, thank you once again for facilitating both the introduction to systematic reviews and formulation of answerable research questions workshops. And we hope that the session was very fruitful to all who attended. The next session, as stated, will be on the 24th of August, and the title of the workshop is Inclusion and Exclusion Criteria, presented by Dr. Tefo Muloy. Please do look out for another announcement regarding this workshop. So on behalf of the Research Capacity Development Team, I'd like to say thank you, Dr. Miriam, and thank you to all our participants once again for staying throughout the session. So please do have a lovely Friday further and weekend. Thank you.
Yeah, thank you so much, Mr. Puko and the team. Thank you so much. I really appreciate it. Thank you, listeners. I hope we must have learned one or two things from here. Thank you, everyone. Goodbye.